Good morning, everyone. Lots going on. Lots has happened in the last 24 hours. And I mean, from Trump declaring a national emergency, and I don't have any tabs about the United States in our show today, but there's lots happening, and this is a very fluid situation. And this was an interesting read right before I went to bed last night. Mr. Goldstein points out some math, and sometimes math can be elusive, but this math is pretty straightforward. So it's interesting. Here we go. Here's the thread. Something I don't understand about predictions. 30 to 70% of Canadians will get COVID-19 virus. 1, China was the epicenter of the pandemic, and yet the World Health Organization now says only a handful of new cases are being diagnosed daily, and the new epicenter is Europe. I'll just retweet that while I'm here. So far, China has reported 81,000 cases of infection and 3,000 deaths. 3, China's population is 1.4 billion. A 30% infection rate would mean 420 million infected. A 70% infection rate would mean 980 million people. So how do we get to 81,000 cases of infection with the virus now on the wane in China to at least 420 million infected and up to 980 million infected? Let's say the Chinese government is lying and there are actually 100 times more infections than they claim. That's 8,100,000 people. So how do we get to 420 million to 980 million being infected, even if the Chinese government is only reporting 1 in 100 infections? 7, finally, what is this 30% to 70% infection rate being claimed for Canada based on? Can anyone enlighten me on this? I'd love to know the answer to that if anybody knows, by the way. That would be 11.4 million to 26.6 million Canadians infected, when, as of Friday, we had less than 200 infected and 1 death. While those numbers are going to dramatically increase before efforts to control the virus kick in, how do we get from 200 people to up to 26.6 million people? 9, granted, China as a totalitarian state can impose much harsher measures on its citizens than Canada, but our healthcare system is much better, relatively speaking, and we're taking measures much earlier, relatively speaking, than China. Plus, there'll be a vaccine in a year or 2. I don't believe the vaccine thing, by the way. Can you just let me know when they come up with a vaccine for HIV? I was going to say HIV, yeah, right? Or the cold, or the flu, or anything. When they start rolling out those vaccines, then I'll expect one for COVID-19. And somebody can say, oh, it's the same virus all the time. Isn't HIV the same virus all the time too? Like, isn't it the same one? Or is it mutating every time that somebody gets HIV? Like, I'm pretty sure it's a stable virus. And I'm not a virologist. I don't know. I really could be wrong. If I'm wrong, I'll pin the comment. I don't mind being wrong, but from my limited knowledge of the world, because, I mean, my goodness, I think everyone's knowledge of the world is limited. If we're not rolling out random cures for HIV that's been a problem since 1980, I don't think, oh yeah, a year or 2 is a reasonable expectation for a virus for this. Sorry, back to Mr. Goldstein here. 10, but we're going to go from less than 200 infections today up to 26.6 million. How? And, okay, the 26.6 million is not catastrophizing. It's just using the top end of the scale and from 200, from 2 deaths and 200 people now, right? Like, that's the absolute bottom to the absolute top. And I don't know who knows, right? It could be that high. The Canadian government is moving to hire nurses, and the starting salary is $80,000. I was reading some complaints about nurses when this was being shared on Twitter, and I decided to look at the salary of nurses when they're coming in. So yeah, it's a pretty handy raise. So usually a starting nurse gets $5,660 per month, right? So there it is, the first year, first block. That's where you'd start in your step. Every year here and every number of hours, 1,950 hours, you get another step. So pretty quickly you're making a lot of money, right? So I did the top. I did 7,000 per month and 5,000 per month. So that covers quite a lot of it. So it's up to 89,000, and this job posting here for nurses goes from 80,000 to 122,000. I didn't do the top end of the scale. I didn't start doing that math, but you get the idea, right? Like, the starting salary is much higher. And I have to point out, you couldn't pay me enough to go work in a hospital right now to port anything, carts or anything. No, sorry. Like, my hat's off to the healthcare workers who take their lives in their hands daily to go help sick people. Well done. I couldn't do it anymore. I couldn't. So, and I mean, there was a time maybe, right? But also I'm squeamish, so maybe I could never have done it. Anyway, I digress. Here is Roxham Road. Now, remember when Justin Trudeau was saying that there were screenings and all sorts of really, really great things that are happening at the airport. Here, we'll prime it with this. Here's Ezra Levent saying, Trudeau refuses to cancel direct flights from China. Today, planes landed from Shanghai, Chengdu, Hong Kong, Beijing, and other cities. Upon arrival, migrants are asked a question on a screen, a touch screen, in English and French, if they've been to Hubei province, and then they walk through. I wonder if, like, and I'm pretty sure, like, obviously Chinese have different alphabet than the North American Western alphabet. So maybe they probably recognize Hubei province in English, but would you recognize like the name Guelph in Chinese? Like would you? I don't know. Anyway, so it's interesting. And then it's a touchscreen, right? Here's the whole thing. Do you want to touch any of that? No. No. Have you been to, don't touch right here. Don't touch it. No. Oh my goodness. Anyway, and then touch your face, right after. Ouch. So here's Keenan Bext. He's a rebel reporter, and I'm not like Ezra and Keenan do a good job, and I think this is worthwhile within context. When you arrive at the airport, you have a touch screen. You have a questionnaire with a touch screen that just looks gross. But when you arrive via Roxham Road, nobody's testing for COVID-19. Here's Kian asking, where are you from? Did anybody test you for COVID-19? Here you go.
Where are you from?
Je suis Congolais.
The Congo?
Ouais.
Have you been checked for the coronavirus? Where'd you get those designer bags?
So, I mean, like, this is happening currently. This was recorded 18 hours ago, and I have no reason to believe that Kian paid these people to walk across or had anything to do with them. He's just recording what's happening. Similar to me, I'm just showing you what's on the news. It's wild, right? Like, if we've got a pandemic, we do. Is that not the time to close the borders and stop the flights and travel restrictions? Oh, here's some travel restrictions for Canadians. Apparently, travel restrictions work when it's for Canadians. Government asks Canadians to avoid all non-essential international travel. Don't go to the US, don't go to Europe, don't go anywhere. Stay where you are, stay in your homes. And yet, right? You're telling Canadians not to travel, but you're letting foreigners from hot zones travel here. Got it, right? So not only are they landing flights from, and that's why this tweet was down there, because he's talking about the landing flights from hot zones, from infected areas, but you're letting in people who are unscreened into the country, just willy-nilly. It's insanity. It doesn't make any sense. It doesn't make any sense. Here's Parliament suspending for 5 weeks over COVID-19 concerns. The House of Commons and Senate are shutting down for 5 weeks to help prevent parliamentarians from contributing to the spread of COVID-19 after an extraordinary unanimous agreement among the federal party. Shocking, right? Oh, we all agree on this. Let's all stay healthy and not here. The suspension means MPs and senators will miss 2 sitting weeks, and they had previously planned to be away next week and 2 weeks in April. It will keep legislators from traveling back and forth between their constituents in Ottawa and from sitting together by the dozens in Parliament and in close quarters in committee rooms. Now, I mean, realistically, this is a good idea. You can't, if one person's got it, say, Seamus or Justin Trudeau, who's been exposed by his wife and by the Iranian leadership and by Seamus, if you've got Justin Trudeau who's infected and he sits in a committee room with 5 people and then they all go back to their constituents and have meetings and stuff, and then months later, all of these clusters start showing up. Yeah, that's bad news, man. You don't want that. That's terrible, right? So it makes sense. It just seems like kind of funny, like kind of obvious, right? Like that they're all going to agree. Like, yeah, let's not be in the place where the infected people work. Because I would agree with that, really, really. I would call in sick. That'd be that. Back to the article. The move also hastened parliamentary approval of the new trade deal among Canada, the United States, and Mexico. The USMCA. Call it what it is. Like, it's not new NAFTA. It's USMCA. It's not that hard, guys. Back to this. The House of Commons unanimously passed a bill on the trade deal and a handful of others on spending measures. The Senate quickly gave its nod to the legislation, which then received royal assent. It's amazing how quickly government can get done when they want to get out of there, eh? Deputy Prime Minister Chrystia Freeland called the passage of the trade bill a great example of all-party cooperation. We work together as Team Canada, and that is also what we're going to do in rising to meet the challenge posed by the coronavirus epidemic. However, the federal budget slated for March 30th won't be delivered that day. It was postponed to a time yet to be set. I think yesterday I reported on Bill Morneau saying budget's going to be done on March 30th. I said, yeah, not a chance. And, one day later, I was right. Back to this. The Commons is scheduled to meet again April 20th, when the Senate is slated to return April 21st. The government House leader Pablo Rodriguez, who explained the plan with counterparts from other parties standing alongside him, said the Commons could come back sooner if an emergency requires a meeting. We will face this together, and we will get through this together, he said. The deal to suspend the Commons came together Thursday evening after discussions among the parties about how to ensure federal dollars would continue to flow during the recess and how the government would be held accountable for them. And this was published yesterday. Today is March 14th. I just closed a tab that I didn't mean to close. So here it is. I just wanted to show you this. Viruses don't carry passports. Why travel bans won't work to stop COVID-19. This is just propaganda garbage. And I want to point it out because viruses don't travel on planes without human hosts. So do viruses need passports? Maybe not, but they need human hosts who do need passports to generally travel on planes, unless they're being flown in by the UN or somebody else from somewhere else for some other purpose, refugees or something to that effect. But most of the time, they need a passport. So this is just propaganda garbage. I'm not going past the headline because it's dumb. It's dumb. Justin Trudeau says, I do not show any symptoms. Trudeau says there's no need for him to be tested for COVID-19. Prime Minister Justin Trudeau said he has not been examined for COVID-19 based on the advice of healthcare experts after his wife, Sophie Gregory Trudeau, tested positive for the virus. Quote, it was explained to me that as long as I do not show any symptoms at all, there is no value to me being tested, Trudeau said Friday in a press conference where he was several meters away from reporters. Trudeau and his family are in self-imposed isolation for 2 weeks after Gregory Trudeau was found to be showing symptoms of COVID-19 virus. She later tested positive. The situation faced by the Prime Minister reflects a wider uncertainty in Canada over whether people should enter self-isolation and whether the country is testing enough potential patients as a way to get a firmer grip on the virus. Okay, and I just wanted to show you, here is the droplets can travel 4.5 meters and stay for at least 30 minutes, shows wearing masks helps. And this was the bus study done in China, and it was published early on in this whole thing, talking about how this was airborne and it sticks around, right? This person didn't have any interaction, and other passengers on the bus were infected from that passenger. I'll read this in a minute, but I also wanted to say that there are studies that show that pre-symptomatic you are. I was watching Dr. John Campbell yesterday, and he's a good resource if you're interested. Although he praises China a lot, and it makes me question things because everybody's praising China like crazy. And last I checked, this started in China. So let's check ourselves for the China praise, right? Like if they're cleaning up their mess, that's one thing, but where did this thing come from in the first place? So grain of salt. But I like Dr. John Campbell. He's a good guy as far as I can tell. So anyway, here we go. Asymptomatic transmission. Hold on. This was published by Science News 16 hours ago, and it says, the headline is, coronavirus is most contagious before and during the first week of symptoms. As sweeping efforts to contain the COVID-19 pandemic go into effect around the globe, researchers are starting to get hints of just when patients are most contagious. People infected with the SARS-CoV-2 virus. Why are you changing the name again? COVID-19. Okay, which causes the disease may test positive for the. Oh, okay. This is the thing that causes this. That's why. All right. So the SARS-CoV-2 virus causes COVID-19, the sickness from the virus. Whatever, which causes the disease may test positive for the virus both before and after they have symptoms. But a new study of 9 people who contracted the virus in Germany suggests that people are mainly contagious before they have symptoms in the first week of the disease. So Canadian doctors are inept or not up on the most recent science. But even the WHO has been saying for a while now that this is contagious when you're before symptoms show. So, I mean, it's just wild. And here's I hope the reporters maybe were wearing masks. I don't know. It says the study was carried out by a team of researchers from Hunan, not Huaibei, but Hunan, who were investigating an outbreak that occurred on a long-distance air-conditioned coach whose windows were all closed. An infected passenger ended up spreading the virus to several others on the 48-seat bus, reported the South China Morning Post. The carrier sat in the second-last row seats, but managed to infect passengers sitting up to 4.5 meters away from him, despite not interacting with anybody at all during the 4-hour journey. Here's a diagram of the bus layout that shows where the carriers were seated and where the other passengers whom he infected were seated. Crazy, eh? Wow. So, initial COVID carrier, the red guy, the COVID infected, infected 30 minutes after initial carrier disembarked. Wow. And infected with no symptoms. So you can spread this asymptomatically, despite what our prime minister is saying and telling people. It's very, very scary. So here is a Monty Python meme of just how well we've been reacting to this. Here we go.
Stage 1, we say nothing is going to happen.
Stage 2, we say something may be going to happen, but we should do nothing about it.
In Stage 3, we say that maybe we should do something about it, but there's nothing we can do.
Stage 4, we say maybe there was something we could have done, but it's too late now.
Cat's out of the bag. Virus is out of containment, and now we're in the delay strategy. And well, people are drawing guns at grocery stores for food. Welcome to Canada 2020. Is this where you thought we'd be with that progressive liberal government we all elected in 2015? Is this where you thought it would take us? I mean, the coronavirus aside, right? Canadians with guns ablazing in the Loblaws, right? Get away from that can of Spam, buddy. I swear, if I have to cock this and take the safety off. Was it a legal gun? Was it a farmer who came in from the surrounding farms, and he had one in his, down the leg of his pants there? He pulled it right out? Or was it a legal handgun? An RPAL guy? Yeah? No? Oh, maybe an illegal handgun? Yeah, because we're not doing anything about that. And it's unfortunate that coronavirus is taking up so much room from the regular politics of it all, because the regular politics of it all are still clearly going on. People are just crossing our border indiscriminately. Who's checking those bags? Nobody's checking them for coronavirus, and this is the biggest thing, period. There's a kiosk, right? Look at that. There's a kiosk at the airport. Nobody's checking them for coronavirus. Maybe we should have a kiosk that says, are you carrying weapons to sell to Canadians later? Yes or no, right? Just can you self-isolate the weapon in this bin? Just please, It's so dumb. It's ridiculous. Anyway, I apologize for coronavirus taking up all the oxygen in the room, but this is 2020 in Canada. Maybe Justin will get another 4 years. Ugh. Anyway, thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co. Stay safe out there. Wash your hands and have a wonderful, wonderful day.